Routine child wellness appointments are regular doctor visits to track growth, development, and provide preventative care. The schedule is frequent in infancy and toddlerhood, with a shift to annual visits starting around age 3 through the teen years. These appointments are different from visits for sickness and include screenings, vaccinations, and guidance on nutrition, exercise, and behavior. This video will help you understand the types of visits based on age, when to schedule them, and how to use proper coding. Well child visits in the first 30 months can be met when 6 or more well child visits are conducted in the first 15 months, as well as 2 or more well child visits that are conducted between 15 and 30 months. Listed are the ages for well child visits, as recommended by the American Academy of Pediatrics Bright Futures Periodicity Schedule, CPT codes, and diagnosis codes related to well child visits. Please note that a QR code and link will be available at the end of this video with all the information in this presentation. Preventive care in childhood and adolescence sets the foundation for lifelong health. Immunizations protect against serious diseases, and lead screening helps prevent developmental delays. These measures improve patient outcomes and impact quality scores. Compliance is captured electronically. Note: accurate documentation and coding are essential. The Childhood Immunization Status Measure assesses whether children receive a complete series of immunizations by their second birthday. This includes multiple doses of DTaP, IPV, Hepatitis B, hepatitis A, pneumococcal conjugate, PCV, MMR, influenza, rotavirus, and varicella vaccines. Timely immunizations protect against preventable diseases during a child's most vulnerable years. At each visit, use your EMR to confirm immunization history. If any doses are missing or delayed, discuss the importance of catch-up vaccinations with the caregiver. At each visit, use your EMR to confirm immunization history. If any doses are missing or delayed, discuss the importance of catch-up vaccinations with the caregiver. If completed, document dates and vaccine types in EMR. The Immunizations for Adolescents measure evaluates whether adolescents receive Tdap, meningococcal, and HPV vaccinations by their 13th birthday. This is a critical window to build immunity before teens become more socially active and are at risk for disease exposure. Use each encounter to review vaccination history and encourage series completion. The HPV vaccine requires 2 doses if started before age 15 or 3 doses if started later. Ensure accurate coding in the EMR to meet compliance standards. Providers should ask: has your teen received meningococcal, Tdap, and HPV vaccines? If due, schedule or administer vaccines and document dates and vaccine names in EMR. The lead screening in children measure ensures children receive a blood lead test by age 2. Lead exposure can negatively impact cognitive and physical development, especially in children living in older homes or high-risk environments. Lead screening is typically ordered at the 12 or 24-month visit. Compliance requires a documented result, not just an order or questionnaire. Encourage caregivers to complete the lab if it's pending, and always verify result documentation in the EMR. Providers should ask: has your child had a lead screening yet? If yes, record date and result in EMR, and if no, then offer to schedule the test. Developmental delays affect 1 in 6 children in the United States, and early detection is key to help members receive the support and care that they need. Children should be screened for risk of developmental, behavioral, and social delays using a standardized screening tool in the 12 months preceding or on their 1st, 2nd, and 3rd birthday. Common examples of acceptable screening tools include Parents' Evaluation of Developmental Status, Ages and Stages Questionnaire and Survey of Well-Being in Young Children. For this measure, the MCHAT and ASQ-SE are not approved screening tools because they are focused on only one domain of development. Note that billing CPT code 96110 alone does not meet compliance. Please include claims with a modifier that indicate a global developmental screening occurred. Child and adolescent well care visits. Track the percentage of children and adolescents, ages 3 to 21, who received a preventive care visit with a PCP or OBGYN during the measurement period. These visits are essential for monitoring child development, updating immunizations, and identifying health concerns early. One or more well-child visit with a PCP or an OBGYN practitioner is required during the measurement period. Note: the practitioner does not have to be the practitioner assigned to the child or adolescent. Some ways to close the gap for this measure include: schedule routine well-child visits annually for each measurement period. Maximize opportunities by completing well visits during follow-ups, sick visits, or physicals when clinically appropriate. Ensure comprehensive care is provided. Direct outreach to high-risk or overdue patients to support visit completion. Highlight the value of well-child visits, including immunizations, developmental screenings, and addressing caregiver or patient concerns. Automated reminders via phone, text, or portal for upcoming or missed visits. Schedule the next well-child visit appointment at the end of the visit. As an important reminder, telehealth well visits do not meet measure requirements. Correct coding is important now more than ever. Here is a helpful list of approved National Committee of Quality Assurance codes used to identify services included in the well child visit measure. CPT codes 99382 through 99385, 99392 through 99395. HCPCS codes G0438, G0439, S0302, S0610, S0612, S0613. Over the last 3 decades, childhood obesity has more than doubled in children and tripled in adolescents. It is the leading health concern among parents in the United States, surpassing drug abuse and smoking. Documentation of the following for persons ages 3 to 17 who had evidence of an outpatient visit with a PCP or OB/GYN. Height, weight, and BMI percentile. Date of service and code for nutrition and physical activity counseling. Because BMI norms for youth vary with age and gender, this measure evaluates whether BMI percentile is assessed rather than an absolute BMI value. The weight assessment and counseling for nutrition and physical activity measure requires specific coding for BMI percentile, nutritional counseling, and physical activity counseling. Proper documentation of all 3 components is critical. Telehealth can be used for some services. The following are some examples of appropriate documentation for each of the following. BMI percentile documented as a value. BMI percentile plotted on an age-appropriate growth chart. Only evidence of the BMI percentile or BMI percentile plotted on an age growth chart meets criteria. Ranges and thresholds do not meet criteria for this indicator. A distinct BMI percentile is required for compliance. Documentation of greater than 99% or less than 1% meets criteria because a distinct BMI percentile is evident. Counseling for nutrition. Documentation of counseling for nutrition or referral for nutrition education. Discussion of current nutrition behaviors. Counseling for physical activity. Documentation of counseling for physical activity or referral for physical activity. Discussion of current physical activity behaviors. Examples include exercise routine, participation in sports activities, and exams for sports participation. Thanks for watching. Screen the QR code or click on the link for a transcript of this video.